In this second part of my presentation, now I will be going to discuss about serotonin. It is a neurotransmitter and it is also known as feel-good neurotransmitter because of its role, like it maintains and plays a key role in maintaining vital functions of human body like sleeping, digestion, wound healing, bone health, blood clotting, etc. Serotonin levels are too low or too high can cause physical and psychological health problems as well. Serotonin plays several roles in our body, including influencing learning, memory, happiness, as well as regulating the body temperature, sleep, sexual behavior, and hunger. Lack of enough serotonin is through to play a role in depression and anxiety and other health conditions. And it is to be noted that most of the serotonin is uh, made by our body is in intestines, and about 10% of the serotonin is produced in our brain. Now, a question arises that how does serotonin do? What does serotonin do in our body? It plays its role in many parts of our daily life. Like uh, if I talk about the mood, serotonin in our brain regulates our mood. It often called a body natural feel good chemical. When serotonin is at normal level, we feel more focused towards our ambitions. We are emotionally stable, happier, and calmer. Low levels of serotonin are associated with depression. Many medications are used to treat anxiety, depression, and other mood disorders, often target ways to increase the level of serotonin in our brain. Digestion. So most of our body's serotonin is in our gastrointestinal tract, where it helps to control our bowel function and plays a role in protecting our gut. Nausea. Nausea is triggered when serotonin is released into your gut faster than it can be digested. The chemical message is received by your brain, which you perceive as nausea. Sleep. Serotonin, together with another neurotransmitter, dopamine, which I'll be going to discuss in the next part, dopamine plays a role in the quality of our sleep, how well and how long we sleep. And the lack of serotonin causes insomnia and other diseases as well, which will lead ultimately towards a mental illness, depression, anxiety, etc. Wound healing. Serotonin is released by platelets in our blood to help heal wounds. It also causes the tiniest blood vessels, arterioles, to narrow, which slow blood flow and help clot to form. This is an important process in wound healing. And if someone has disturbed level of serotonin in the body, if I talk about low level of serotonin in the body, might be a bit more complex case when it comes to wound healing or uh, clotting of blood at the area of wound, and it ultimately can cause more loss of the blood from the body. Bone health. Serotonin level play a vital role in the density of our bones. High level of serotonin in your gut may play a role in making bones weak, which can lead to bone fractures and osteoporosis. Osteoporosis is a type of diseases in bones. What problems are associated with low serotonin levels? Problems like depression, mood problems, anxiety, sleep problems like I have discussed, insomnia, digestive problems, societal behavior, and panic disorder are a few types of problems that are associated with low serotonin levels. Like everything has its disadvantages and advantages at its both lower value and higher value as well. So, what can I do to increase serotonin level? Eating more tryptophan containing foods. Tryptophan is an amino acid that is not manufactured in our human body, and we have to take it from the outer environment, from the dietary source. so that we can maintain our serotonin. Getting more sunlight, taking certain supplements, and getting more exercise can lower our stress level and ultimately increase our serotonin. Now, the foods that can increase our serotonin level are salmon, eggs, cheese, pineapples, and some dry fruits and oats. But there is something need to be concerned that eating foods high in tryptophan will not necessarily boost serotonin level on its own. It's a complex process. Your body needs carbohydrates to release insulin to absorb amino acids. Then even tryptophan does not get into your blood. It has to compete with the other amino acid to get absorbed to your blood. Scientists are still studying how eating tryptophan containing foods possibly boost serotonin levels.